Now we're going to get down to the nitty-gritty of what Indians are all about.
I still say we Indian people are believers in the truth. This is the way of life that was given to your people. You're born an Indian, you're going to die an Indian. Indianness is a good life. You're facing an Indian this afternoon.
Welcome back to Muskogee Radio here on the Brew, 1240 AM and 106.3 FM. Thank you for joining us here. And speaking of joining us here, an old familiar face, Mr. Jason Salzman. Thank you, sir, for coming in. We appreciate it. Now, you're wearing a new title these days.
Yes, sir, Gary. Thanks for having me so much on the program. Very glad to sit in for the Principal Chief this morning and get some information out. And he's a very busy man, of course, right now. And so glad to be able to answer anything to the best of my ability and keep our citizens out there up to date and brushed up on what's going on with the tribe as we face this global pandemic, this global crisis that I feel comfortable saying that we've never seen before at this point.
Right. Well, that's the closest thing we've seen lately was the Ebola, and a lot of people are making reference to the, was it 1918 Spanish flu. We have not quite reached those sorts of limits or expectations or whatever you want to call it, but right now Oklahoma has seen people dying of this particular virus, and there are cases. Now, numbers popping up within Creek jurisdiction, although we have not heard of Creek citizens being affected yet, or anyone in Omogi for that matter. Okay, now I'm sure people are kind of wondering where we are. We just spoke with the folks who are doing the census work, and they're constrained somewhat from the physical limitations, but we're understanding now that the tribe is in a position where many of the facilities are not quite open anymore, and some are partially open, and some of our personnel have been furloughed, so to speak. So why don't we start there, kind of give us the official word.
Well, we started everything sort of on a tribal level with this late February and really the middle of February. It sort of was on our radar, getting together a Muskogee Creek Nation coronavirus task force, which consisted of our Muskogee Creek Nation Department of Health, the CDC, which was involved with guidance and everything like that, but also all of our cabinet members and directors that are in place right now, basically to just see where we're at, what we're looking at, and as the thing started to intensify, so did the tribe's response, almost in lockstep. With this thing is changing hourly, and from the office of the Principal Chief, since that time, we have had daily consultation, and I mean 7 days a week, 24 hours a day on the job. If we're not physically in the office, we're talking about it on the phones. We're working with different agencies to see what we can do. But the very first thing that the tribe really did that kind of got everyone's attention was that the chief declared a state of emergency for the Muskogee Creek Nation. And really at that time, it was more of a opening up for maybe the recouping of federal funds on anything that we might have a loss with. And then, the other eye-catching part of this was closing all the casinos. That was a very tough decision, but it was one that we felt that we wanted to be on the front end of, not the back end of. We wanted to be proactive, not reactive. With this thing, it was very important for us and our tribal members to know that the safety, the public health of our citizens and the public in general are paramount. It's not about money. It never will be about money. It will always be about taking care of our citizens. Every decision we've made, the bottom dollar has been at the very back end. It's been considered because we have employees to pay, and we are paying those casino employees while they're out for the time being. We are also paying our citizens. We went to a non-essential versus essential model for our Muskogee citizens and our employees at the complex. So you guys may have felt this at Muskogee Media as well. You probably got people working from home. If they can't work from home, paid administrative leave, and taking care of them in that regard, because we understand that this isn't something that anybody brought upon themselves, that the tribe brought upon itself. This is something that is affecting us all, that we are having to basically do the best we can to respond to it. And every action we've taken has also been in consultation with the other tribes. We're on weekly conference calls with the tribal chiefs of the 5 tribes. We are on a statewide conference call with all the chiefs regarding the gaming decisions. And also, in those weekly tribal consultations, we're talking with the chiefs, and we're seeing that in the Intertribal Council, I can't speak for all, but in the Intertribal Council, the Chickasaw Nation, the Seminole Nation, ourselves, the Cherokee Nation, and the Choctaws, we're really in lockstep with all of the personnel and HR moves type of things we made with our employees. 65 and over, chronic illnesses, anything that puts them at risk, go home, and we'll ask questions later about semantics and everything like that. Paramount to us is that they are safe and that they are not at risk. So we have been in talk with federal grant agencies about what may arise from, let's say we have a federally funded grant program, then that's how those employees at one of our programs gets paid. There are restrictions on that. Some of those grants require certain things. We've been talking with federal agencies on exactly what the word is on those restrictions right now. And the preliminary talks that we've gotten to this point is that exactly what we are feeling ourselves is that get the people home. That's the paramount thing right now. We're not worried about restrictions or anything like that.
That's got to be an incredibly tough decision. I mean, I think in terms of the economic wallop we're getting, not only in terms of revenue, which is hugely significant, but the people who work there too.
Yeah, and you're talking about the gaming side of it, right?
Mm-hmm.
Okay, yeah. That some of the things that the public doesn't see are the things that I think that sometimes that I wish that they could see. The GOAB meeting, when the decision was made to close all of those facilities, was the best word I can come up with right now is taxing. Just look on everyone's face. Nobody's defeated, but at the same time, we understand the gravity of these situations and these decisions that are having to be made. And I would ask everyone out there, I don't want to get too heavy or anything like that, but just keep your tribal administration, your chiefs, your council members, your decision makers, and all of us really in your prayers, because this is something that they're carrying daily on their shoulders. I promise you, they're not trying to interrupt your services. They're trying to make sure that we stop the spread of COVID-19 at all costs so that we can get back to normal routines, normal business at the tribe. It's not about interrupting service. That's the last thing we want to do.
Right. Actually, I had a phone call the other afternoon from a lady who said some of them are taking it upon themselves to contact the Creek citizens to all pray that evening at 7 p.m. for a halting of this disease. Our own people and all Americans, and saying, just take a moment or so to ask for some help that comes from above. Yeah,
and not all guidance comes from the CDC. We can get guidance from the Creator, whoever we believe sends us, spiritual strength and guidance at this time. And for a lot of our folks, that comes from Ofunga. From a lot of our folks, it comes from Jesus Christ. From a lot of our folks, it just comes for their own inner fortitude and the strength that they have within them. So we're calling on you to whatever you want to. And Gary, I'm glad you asked that, because it allows me to share some good things that we're seeing. We're seeing citizens band together to take meals to elders. We're seeing citizens from different departments combine with other departments that they do not work at to help clean and disinfect areas so that we can stay safe at the buildings, the ones that have to be there. We're seeing citizens and departments take fleet vehicles, okay, from the fleet vehicle pool and take them to health and say, whatever you need these vehicles for at this time, EMT services, emergency, whatever. If it gets to that point, these are available to you first, and then we'll figure out the rest of it behind that. We really want to push a One Muskogee initiative, and that is all people out there that are listening. If you want to volunteer, call me. Look me up, Jason Salzman, 918-732-7209. I'm sorry. New office, new phone, so bear with me there. jsalzman@mcn-nsn.gov. That's a better way to get a hold of me. jsalzman@mcn-nsn.gov. If you're out there and you want to volunteer and help in any way that you can, email me. I will put you in a database. We are plugging people into the situations where they are needed the most. So that's out there, and I'm proud to say that our citizens are doing it.
Well, I understand you got this new position and coming in a huge challenge.
Yeah, it's been really a lot of fun.
I noticed it's upgraded your wardrobe.
Well, sometimes you got to look the part, even in the midst of crisis, so.
Right. Yeah, actually, that's true. Now, as we were talking about CDC, that guidance from them, I'm thinking, well, there's the federal agency, but there's also the Creator's Divine Care.
Yes.
CDC.
Yeah, hey, nice, very good stuff. You might want to copyright that.
Yeah, it took me a second or two to think of it. Now, what is the position in regards to facilities and personnel for the tribe? People are kind of wondering, is it all shut down? Is it all, you can't get in, or only the most severe cases, or blah, blah, blah. So let's talk about the executive branch right now.
Well, I have good news for your program because
You're still here.
Well, any newsman would love it when somebody comes through with, I have breaking news for you. But breaking news today is that effective today at noon, we are closing all Muskogee Creek Nation buildings, lobbies, areas to the public. Effective at noon until further notice. We are closing down our buildings and our complex facilities to the public. And that's happening at noon today. So if you come to the building, if you come to the tribe expecting to get in, and you're not an employee that reports to that building regularly, you will see a sign on the door indicating you to stop and contact the number that is on that building's sign if you need anything. Also, they can contact the tribal number main line and get information there as well. Our operators are still operating, and they are sending people out to the number or the respective department or facility that they need. So, folks, I can't stress it enough. We are not shutting down the tribe. We are just shutting down access to the public in our buildings. We have to do this at this point to stop the spread of this COVID-19 virus, to flatten the curve, do what we can. People are dying. It's serious, and the tribe's getting serious, and we have been serious, but it's time for people to, and I can't stress it enough, stay home. It's time for people to stay home, and it's time for little trips to the tribe to get your citizenship card, to get your tag. That doesn't matter right now. It doesn't matter anymore. They're not. The Oklahoma Highway Patrol has said they are not pulling on anybody over for an expired tag right now. They are not. And we also, people out there, your citizenship card will be waiting for you whenever we get past this, I promise. And those things are not important right now. The most important thing is that we stop the spread of this virus so that we can get back to normal. Because if we don't stop the spread of this virus and we are closed down for a prolonged period of time, what does that do for the services that we can provide? It gets them a big hit. So please, to stop the spread of this and to get back to normal as soon as possible so that we can fully provide services and things to the people of the Muskogee Creek Nation, please just stay home and shelter in place as best as you can.
Okay, to again summarize and underline what you've just said, first of all, the buildings are going to be closed today at noon.
Today at noon, yes.
So that doesn't mean that the tribe is going out of business.
No.
There will be business conducted. You're just going to have to find another way to do it, over the phone or perhaps by computer.
Yes.
Or I don't know what else you could.
Yeah, there will be web-based services. Everything that you can do online, do it online. The tribe is not in any way, shape, or form wholly shut down. This is just a physical building, lobby area, any gathering place really is shut down. And we would also encourage people to stay in groups of, if you are in a building and you are essential and we do need to keep things rolling, we need to keep getting meals to our seniors, we need to keep our food distribution centers open. And talking with the other tribal leaders, that's been the key, that's been the focus is, hey, who would argue that food is, a non-essential thing? No, it's very much essential, and we need to keep the food services in place and rolling as much as possible, especially with the economic interruptions that we've seen dealing with this issue. So the food service, food distribution, we're still good there. There's no interruptions there. The food, our elderly nutrition program, the homebound seniors are still getting their meals. Everyone that dines in, come get your meal, take it to the house. There's to-go meals only. I think there's only one. There was only one food distribution center that had been sort of affected. That was in Wetumpka, but I think we've gotten volunteers together. We've gotten people together, and we're trying to make sure that nothing is interrupted in our food distribution program whatsoever. So there's people banding together saying, I'll go here, where do you need me? I'll go here, where do you need me? And that's really, really strengthening the chief's heart right now, because the chief is under a great amount of pressure and stress and everything like that. But he's holding up great, and he's doing a great job for the people. This is a chief that cares about his people. I promise you that. And he is somebody that will take it to heart, and he'll want to help. And this is also a chief that I was telling Jared out there in the lobby. This is a chief that has a problem a little bit with social distancing. we got to get him to quit hugging people because he's just a very he wears his heart on his sleeve. And so one of the things that he's doing, the actions that he's taking, have the people and their best interest at the very forefront of every decision, and of every phone call he takes, of every meeting he has to be in on, and really the meat and potatoes of this thing, and the tough thing is the decisions he's having to make.
Oh man, I couldn't imagine coming into a new job like he did, and bang.
Yeah.
Of course, the guy, his predecessor, also had one, huge with the budget. But he's hanging in there. Everything I've heard so far has been, in a positive direction, but tempered with a word of caution here and there. Sure. Now, we've been getting piecemeal a lot of notices that events have been canceled. And first of all, I think it's going to be horrendous effect on the Wild Onion Dinner.
No, don't. I'm telling you, it's straight from the top. That guy's about he's about as crushed about those as anybody. I promise you. But in the spirit of not being too heavy-handed on this deal, because we realize that those are church functions. Those are church fundraisers. In a lot of ways, those are the things that keep the churches going for the whole year. So we wanted to be very careful, and from a tribal perspective, because that's not those aren't tribal events, even though they are in essence and in spirit, because there's so many tribal people, and it's really a cultural thing. That's not a government mandated event, or it's not anything that the principal chief signs off on. So with the Wild Onion Dinners, we left it up to the churches. Mm-hmm. But the pleasing thing is seeing, although we're crushed that some of these Wild Onion Dinners, and most of them have been canceled, we're seeing that the churches are making the right decisions in the best interest of the people and the folks' safety. And that's what you want to see. You don't want to have to mandate decisions that ought to be made in the best interest of folks. You want to be able to have them have the freedom to make the right choice. And we're seeing that, and we're very pleased with it.
Well, yeah, it's quite a target for jokes right now. Yeah. But it might be interesting to see something like
We're taking all jokes right now.
a drive-through, perhaps.
Yeah, no, well, I mean, and that's another beautiful thing about this. Get creative.
Yeah.
Get creative with everything. If you're a business owner out there, get creative with the way that you deliver your services. If you're a church, get creative with the way that you deliver your sermons, that you deliver your message to people, the way that you gather with people. This may change the entire world. Going forth, the way that we gather, the way that we communicate, the way that we are not going to shake hands anymore, I imagine. I will be giving everybody an elbow bump from here on out. But exactly. And I think, not to again sound the alarm, but I think this is a seminal changing moment in society in a lot of ways.
That's seminal, not seminal.
Seminal, seminal. Sorry, I maybe a wrong word choice there, but so no, it's one of those situations where we're and Jared put it really well out there in the lobby. This basically puts us all at square one on a level playing field to then send the roots up in maybe a different way from here on out and see what things look like then. In a lot of ways, we don't know what they look like then, because we're still in the eye of the hurricane. Right. Which is weird because I've always been told that the eye of the hurricane's pretty calm, but this is definitely not calm.
Yeah, you see the movie Twister.
Yeah.
Ain't happening.
Nope, not happening right now.
Has your office heard of any others or anything it's really important to point out at this point that is not going to be happening or will be postponed?
At this time, the things that we've announced are the only things that we've absolutely got a decision on regarding any kind of closure, postponement, anything like that. Just because of the timeline, we don't want to outkick our coverage as far as jumping out there, postponing something that's very important to certain departments and everything like that, or important to our people. Let's say into a grand avenue of something like the Muskogee Creek Nation Festival. At this time, it's just inappropriate for us to explore any sort of final decision, one way or another on those things. I expect that, and I give you my word as the Chief's communications guy, when those decisions are made, they'll be portrayed immediately, and we'll get those out. And that way people absolutely know what's going on as far as different scenarios. But I will say that everything that's been postponed to this point, that's the only thing I really can share as far as decisions that have definitely been made are those postponements. But I would also share that the way that we're operating right now is that we view this pandemic as a life and death situation. So if it's not life and death as far as gathering or an event right now, it ain't happening. So that's the way that we're looking at these things. We can't stress enough apologies for the inconvenience, but also we are counting on there never being in the history of mankind more understanding of those decisions than right now. We ask for the understanding. We almost expect it because of what kind of situation we're in. There's nobody out there that can tell me that they don't know what's going on right now. It's inescapable.
Right.
And so we're counting on that understanding of the situation we find ourselves in.
Let me go to an area here that is, I think, pretty critical in our discussion here. Health facilities, clinics, are they going to be open? Will there be changes in what they will do and won't do?
Yes.
Have we got enough supplies in case there is a huge demand, and can we protect our workers? A lot of questions there.
Right, yeah. The health system, they're taking all available ideas, concepts, everything to protect their facilities and their healthcare workers, because I'm telling you, our healthcare workers are a precious commodity right now. We have to make sure that they are healthy and can come and provide those services, their expertise to patients. Right now, we've taken, and I will just speak for Secretary of Health Sean Terry on some of the steps we've taken. I don't know if you all have been able to report on these yet, but elective surgeries. They're not doing elective surgeries at any of the facilities right now. They're not. They're encouraging. If you are out there and it is absolutely not necessary for you to be at the emergency room, do not come to the emergency room. If you have a sniffle and your throat's a little raspy, don't come to the emergency room for it. If you are having severe symptoms, and I mean, I've got to get to the doctor now, that's when you come to the emergency room. Because, as you mentioned, PPE equipment, protective equipment for our workers. Right now, according to Dr. Beats, yesterday we had a virtual town hall, and according to Dr. Beats, right now we're hearing that in comparison to some other health facilities, maybe some bigger, larger health facilities, our PPE is actually in pretty good standing. And he also received word yesterday morning from Indian Health Services that they will be able to provide us personal protection equipment for those workers as needed. So those things are good news. These are the things that we look at and we go, thumbs up, all right. Talked with Sean Terry this morning, and we're going to start tents on the outside of the clinics for pre-screening, even of the people coming in with severe COVID symptoms that they feel are severe COVID symptoms, to be screened outside of the facility before they're even let in, anything like that. We also have telemedicine that's been put in place. If you are needing to receive your medicine, your pharmaceuticals, the telemedicine that's been put in place, and where you can call. They've also enacted an auto refill on everybody's prescriptions. That's something that people are, I think, probably going to be pleased with, as far as we're just trying to simplify everything while also taking these sort of screening measures and being kind of a wall protecting our facilities and our healthcare workers. But those are the measures that we've taken. And a great resource right now is the Department of Health's Facebook page. Just go and search the Muskogee Creek Nation Department of Health. Also, a great resource is creekhealth.org. If you go to creekhealth.org right now and click on the top marquee of their homepage, it is all COVID-19, everything you need to know, from the Muskogee Creek Nation's COVID-19 hotline to all of the frequently asked questions on this, to their protocols that they've put in place, to numbers for medicines that they may need, anything like that. It's all there in a one-stop shop. And if you are out there and you have internet access, you have a laptop, you have remote internet access where you can access it anywhere, please, in your community, identify your elders that may need some of those, some of that information. Right now, we're developing stickers. I mean, not stickers. I'm sorry. We're developing refrigerator magnets to send home. Those are being in production right now. But refrigerator magnets to send home in the to-go meals with elders to have on their refrigerator, and that magnet will have the tribal home office number, which will get them to any program or department they need for the tribe. It will have the Light Horse Police number, which I'm talking to Light Horse Police today about all the things that they're doing. And also it has the Muskogee Creek Nation COVID-19 hotline.
All right, Jason Salzman, we want to thank you so much for sharing all this information. It's critical stuff. We're going to stay on top of it, and this program, what we hope, will be at your disposal if you need it.